Are you happy with the way you are brushing your teeth? Hi, I'm Dr. Amanda. I'm from Dental Designs Clinic in Singapore. We are right now in Raffles Place, which is the heart of the CBD. There's one thing that we're going to talk about today, which is about mindfulness while we are brushing our teeth. Oftentimes, I think a lot of my patients will notice a question that I always ask them is, are you happy with the way you are brushing your teeth? Sometimes most patients will say, yeah, I've been doing it quite well. I've been brushing 2 times a day, 3 times a day, sometimes even during lunchtime. And then I look at the teeth and then I wonder, if you're brushing so diligently, why isn't it as clean as you and I would both like to achieve, right? Today I'll be demonstrating in the video how to use a toothbrush and how I guide my patients to use a toothbrush in a more intentional way so that they can avoid things that happen to their teeth without them even realizing. Sometimes I can recognize whether you are right or left-handed, and that shows when you brush to one side. Let's say you are right-handed and you are trying to brush on one side, so you brush like this, and then you turn, and then after that you change your hand and then you brush this way, and then you go to the left side here. Okay? Or here. Oftentimes I will see lots of plaque on the top and on the bottom. And if we use a special purple solution to color the teeth, then you can clearly see that there's a pattern to where the plaque is left behind. And that's because at this really strange corner here, so if you brush here, you have to turn your wrist around and then make sure that you follow the curve of your teeth. If you don't follow the curve of your teeth and then you just switch over, that's a common spot that you will miss. And that happens also with left-handers. The other thing is also when you are right-hander or left-hander, often on the opposite side, you tend to overcompensate. So patients will brush quite nicely over here, and then suddenly on the opposite side, you feel like because it's on your non-dominant side, you have to work extra hard. So you do like this, you scrub, and then as a result, sometimes people can get gum recession, which is a big problem, right? Or even like abrasion cavities, which we see quite often. And then you wonder why those fillings don't last, or they keep popping out, or on one side, the gum recession is worse than on the other side. So this is something that you can watch out for. Number 2 is recognizing that your teeth have beautiful curves all over. So as we brush, try not to brush in like a straight direction, but think of your hand moving around the curve as you go along the way, because that means that you try and get your brushing to reach almost in between the teeth, and then round again, and then round again, and then you'll be able to remove a lot more plaque than you think. This also applies with electronic toothbrushes as well as manual toothbrushes. And following the curve, you get to notice, this area is a little bit more tender, this area is a bit more sensitive, and that makes you know which area might need more focus and attention to. If the gums are bleeding and you can follow the curve, then you'll know also where there's bleeding, and then you can let your dentist know where you might need a little bit more help there. The same thing applies for the inside of the mouth. Please follow the curve on the inside of the jaw over here. This is a very common area where, on the inside, where most people, I feel, have the greatest difficulty. It's not that you don't want to brush, I think. It's more that it's a difficult spot to brush, or you feel that the brush is making your tongue push against it, or you feel like you're choking yourself. Make sure maybe you can use a mirror and then you can see your own teeth and yourself. And the last thing would be, before you brush your teeth, think of brushing your teeth as a 2-minute procedure. Tell yourself that this is the time dedicated to brushing your teeth. You will not rush it and you will not think of it as a chore, but it's something that we do to take care of ourselves, so that we start the day right and then we end the day off feeling refreshed with our teeth. So you can look in the mirror, take a deep breath, make sure that your jaw muscles are nice and relaxed, and then when you place the brush in, let's say if you're starting with your top right, let's say you're right-handed like me, right? So you start with your top right side. Make sure that you're not trying to open your mouth as big as possible, because that creates this very tight area over here. So you close your mouth a little bit and make sure that your cheek is relaxed. Look, there's so much space. It's like there's an air pocket in there. So when you relax your face, it really allows the muscles to not stretch around the toothbrush. Sometimes your face muscles are pressing against the toothbrush, and then make sure, you know, with the previous tips, that you get every single little corner. And then at the end of the process of 2 minutes, you should not feel tense. In fact, you should feel relaxed and a little bit more refreshed so that you can start or end your day correctly. Toothbrushing is one of the most basic, cheapest ways of ensuring that we can maintain our nice teeth for a long time. If you feel like there's any areas of your toothbrushing or oral hygiene routine that you might need help in, please give us a call or let the clinic know. You can look for me at Dental Designs Clinic, and I'm really excited to see what we can do together so that we can improve your oral health journey. Yeah, thank you.